Hello all, I'm Dr. Ashwini Kulkarni, consultant psychiatrist, Pune. So today in this session, let us try to understand that when you need to reach a psychiatrist, what are the conditions when your near and dear ones or yourself are suffering from, and this is the time you need to reach your psychiatrist. Second, that what you have to do or what are the things that is expected from the first session when you meet your psychiatrist, and what are the treatment plans or how the session proceeds after meeting them for the first time, and also try to understand what are the advantages when you meet the psychiatrist. So yes, in the first part, let us try to understand when to consult the psychiatrist. So definitely when I get patients, the first question they ask me is, I'm not sure if I need help, or I'm not sure what am I supposed to talk. So at that time I see that there is confusion, there is a dilemma before they have come to me. But yes, let us try to understand the situations. One, every individual has thoughts, they have overthinking. But we need to understand when the overthinking is affecting your sleep, appetite, affecting your work productivity, concentration, bringing a lot of mood swings, irritability, relationship issues, that's the time we need to understand, yes, this overthinking is something which is impacting my life. Where it is anxiety or depression which is there for a longer duration, a constant fear for something, and that fear is affecting your performance, affecting, or you may be avoiding to go in certain situation, avoiding people, certain conversations, and that definitely is going to impact your life, impact your confidence level. Third part is the most important, when there is harm to self and harm to others. When there are suicidal thoughts, when you have extreme negative thoughts, repetitive thoughts to end your life, feeling a life to be hopeless, worthless, you're not able to see the light front of you, definitely that's the time you need to seek help. Fourth one is when you're using substance as a coping mechanism. Maybe you're smoking, maybe you're drinking, using weed, again for the help of improving concentration. Maybe you find relief for a short period of time, but over the period when you're constantly using it to overcome your issues like sleep or your appetite or your overthinking, later that gradually leads to addiction and worsen your situation. Body image issues, when you have issues related to eating disorders like anorexia nervosa, bulimia, where there is binge eating or called as stress eating, when you induce vomiting to maintain weight, that's the time we need to know that yes, this is affecting my physical health as well. We need to know that, especially in the recent past, in the last 2 years, in this COVID situation, we know that there are a lot of loss of our near and dear ones. So handling this bereavement, handling the grief reaction is a time when you need to reach. It is again important to understand that there is no any specific age bar to reach a psychiatrist. From kids, children, adolescents, midlife crisis, elderlies with varied emotional health problems. Anxiety, depression can suddenly impact anybody, affect anyone. There are certain personality issues which may not be seen in the early age of your life, but later, after marriage or after certain situations, when you'll be able to realize, yes, this was there prior in my life and now I realize how it is affecting or impacting me. So yes, all this entire list where we know that these conditions are impacting, affecting my progress in my life, affecting the relationship, not only the individual but the family, society, we need to seek help. So now let's try to understand what to expect from your psychiatrist in the first session and in the follow-up sessions, and what are the things you need to prepare yourself before meeting your psychiatrist. So definitely I have found that there is dilemma or insecurity, or there is always a fear to talk about yourself when you come for the first time. Yes, I understand, because the problems are very personal, but definitely that is impacting your life, and that is why you have thought of reaching your psychiatrist. Please understand that here we are non-judgmental. We would not judge you, we would not criticize you, but definitely you need to be a mirror image to your therapist, to your psychiatrist. Only then they will be able to understand your problem in detail and in depth. So before reaching to your psychiatrist, please try to write the symptoms or the behavioral changes, the conditions which you have been noticing that is creating issues today. You need to mention your physical, medical conditions, the family history of any psychiatric issues, how the relationships is getting impacted, how your work is getting impacted, any past history, any childhood history has to be mentioned. You need to also mention about how you have helped yourself before reaching your psychiatrist. Definitely every individual tries to work on themselves, herself before reaching to a psychiatrist. So what are the efforts you have done before reaching? Any medications, any supplements, any herbal supplements, anything has to be mentioned to them in detail. In the first session, usually the psychiatrist plays an important role in listening to your concerns. So listening is the major part, and most of the patients, when they reach to us, they definitely find that because they're not being listened to at home, among their friends or in the society, that's the time they feel helpless and they reach us. So yes, listening is the first part. We get into the details, as I mentioned, from the childhood to the adolescence, to the relationship issues, marital issues, to the impact in work, physical health conditions, to the doctors and the treatment that has been taken till now. So first time definitely it is a detailed session, more than 30 to 45 minutes roughly. After listening to you, the plan of the treatment is made. We need to understand that the first time you reach a psychiatrist and they would start on a treatment immediately is no. There are situations where after listening to the history, they identify whether the situation is in mild to moderate level or moderate to severe level. So if the need is that we need to get some blood test done, some investigation to be done, MRI brain need to be done, or other assessment like psychodiagnostic assessment, where you can identify certain hidden issues which you yourself are not able to identify. The personality issues to be identified will be needed. So once the assessment is done, the series of sessions where you talk about yourself, because the first session you will not be able to cover the entire life of yours. So we need to understand, we need to give time, we need to be patient. And during the process of series of sessions, gradually you will understand that you are able to develop a rapport, you are able to express your emotional issues. I have found many patients telling me after the second session, third session, doctor, now I feel more comfortable, and this is something which I did not mention to you in the first, and now today I would want to talk about it. So I definitely appreciate this efforts when we give time to the patients, be a good listener to them, be empathetic to them, and understand the issues from their point of view. So once couple of sessions are done, depending on the severity, yes, if the situation is moderate to severe, where there is risk to self, risk to harm to self or others, affecting your physical conditions, or a long-standing condition which you have been fighting for since a longer duration, hormonal issues, other comorbid medical issues where you need to take medication, yes, the doctor would advise the start of medication. But before the start of the medication, as mentioned, the investigation to be done. Definitely the physical examination is done before starting with the medications. The medicines are always started at a low dose and gradually increased. So after the first session, if the medicines are started, don't expect miracles to happen immediately. Please be patient at least for 3 to 4 weeks for the medicine to start its action. As I mentioned to my patients, one, the medicines which we give, definitely patients have a myth like going to a psychiatrist means they will give me a sleeping pill and I'm just going to be down the whole day. No, the medications are rather to stabilize your sleep or to bring the productivity, bring the best in you, get the positivity in you. So that's the myth, and let's try to break this myth. And are these medications going to be addictive? No. We generally remove the patients from the addiction or any kind, like from nicotine to the sleeping pills, when at one time would have been started just for a very short duration by some doctor and which has been continued for years together. So addiction is something which doesn't happen with this medicine. So we need to understand that sleeping medicine, yes, can lead to addiction, but the medicine specific for anxiety, for depression, mood stabilizers are not addictive. And please be patient, because like you take the medication and expecting like the results to be given like a painkillers. No, we need to give time. And the treatment of psychiatry includes not only the medicine, but it also depends on counseling sessions, the therapy sessions, lifestyle modification, which your doctor would be explaining. So what are the benefits of meeting your psychiatrist? First and foremost, as I mentioned, this is the most secure place where you can talk about yourself. You can talk anything and everything, but you will never be judged. You have to be your mirror image. So confidentiality is one thing which we definitely maintain, and we have to respect your information, respect the confidentiality part. So one, you will not be judged, you will not be criticized, but all the information that you would be sharing is definitely for your own health. You would find the better version of yourself over the period of sessions that you are taking. You would find to be more resilient. You would learn how to handle the situations. The better coping mechanisms will be learned, and you will also identify your own strength over the period of few sessions. Third part is you will be able to confront your own fears. You'll be able to identify the hidden fears and how to face them. Fourth is you will also be able to identify if there are certain comorbid other conditions like hormonal issues, females through their menarche to menopause, which would just be considered to be very normal, but yes, that can also impact your life. So we will be able to identify certain hidden comorbid medical conditions as well. 5 is every individual is different. Every individual's way of handling the situation is different. So if I diagnose 2 of you as anxiety, but the reasons for anxiety would be different, the experiences which brought this anxiety in your life is different. So the treatment plan for each individual is different. It's a personalized treatment plan. So based on one individual and the treatment, please do not follow it by the other person, because no two individuals is same. No individuals' experiences are the same, and handling it out, their defense mechanism, coping mechanism, the situations in house, situations in the surrounding is not the same. So yes, it is every individual's way of treatment plan that we make in a personalized way. As I told you, it is just not the medicine part, but also the therapy and certain lifestyle modification. So yes, I think it is the right time when you will be able to identify that what are the issues, when you need to reach your psychiatrist, what are the things you need to prepare before reaching them, and what you can expect over the period of time. And yes, please seek help at the right time. Let's break the stigma and let's work on this emotional issues. It is very important we understand that emotional health or emotional problems are being neglected, but your physical health, all your organs are being functioning, but the importance of you feeling it, experiencing it is more important. The moment your brain functioning is hampered, even if your organs are functioning fine, makes of no use. So yes, please give importance to emotional health, seek help at the right time. Let's break the stigma and spread the happiness around. Thank you.